Hey everyone, this is a review for your heart. It just covers the structure of the heart and some of the beginnings of cardiovascular disease. So it should be a review for you. So it's just considered a cardiac review. So we're going to get started. So you've got a structure and flow of the heart. And I like this picture because it shows you the lung that's included in this flow. And it's got the arrows so that you won't be confused. So you see that your blood starts there in the right atrium, and it goes into the right ventricle. The right atrium to the right ventricle, and you can see that your heart's divided into 4 chambers, but it functions as a 2-sided pump. And just like with any pump, the pipes are important as well, right? If you think about a water well, and if anything's wrong with the well, so if anything's wrong with the pump, then the blood can't get the pipes. If something's wrong with the pipes, then the water can't flow to the pump. And it's the same concept with the heart. So if you can understand a pump, you can understand the heart. Now, the left side of the heart is a high pressure system, and it pumps arterial blood to the systemic circulation. If you see, it's the high pressure. You can tell because there's a huge artery here, the aorta. Well, it's big because it needs to be big because of the pressure and the volume of blood. Now, the right side is a lower pressure system that pumps venous blood to the lungs. So we're going to talk more about that. First we're going to talk about the heart, layers of the heart. So again, 4 chambers, and this is nice and color coded for you so you can see the 4 chambers. And then you've got your 3 layers of the heart. You have your myocardium, your epicardium, and your endocardium. And as you can see, I've color coded them there for you. So your myocardium, we'll start with the endocardium, the light pink. Your endocardium is light pink, so it's the inside, endocardium, inside. And then your myocardium is like the muscle area, where the green. So that's your myocardium. And then your epicardium is the outside, as you can see where I drew in blue. Now, all of these, and I'm leaving one off, aren't I? If you remember your anatomy, the pericardium, that is the layer that covers the heart. It encases the heart. And in between the pericardium and the heart, you've got about 10 to 15 milliliters of pericardial fluid. And this fluid keeps the heart bobbing around in there. So if there is a problem, there's too much fluid, there's not enough fluid, there's infection, there's inflammation, then sometimes the heart is swollen, whatever, enlarged, you may hear a pericardial rub. And that's when you hear the rubbing together. The heart is rubbing actually on that pericardial sac. And we will talk about that later when we talk about complications, but this is just your review of your structure. Now, there are some other things that are involved with regulation of the cardiovascular system. You've got hormones involved. You've got the autonomic nervous system involved. So your sympathetic and your parasympathetic. Sympathetic is your flight or flight. It increases your heart rate. Your parasympathetic is your rest and digest. It tells you to slow down. It tells your body to sit with this. Let's sit with this. Let's digest this. Let's rest. You've got your baroreceptors, and your baroreceptors are found in the aortic arch and the carotid sinus, and they are just sensitive to stretch and pressure. So your body's, they're receptors, right? So your body can sense overload or increase in fluid, and that it will send information to the vasomotor center in the brain. And this can result in temporary inhibition of the sympathetic nervous system. So if your sympathetic nervous system kicks in, your parasympathetic and your baroreceptors are, notified. Your parasympathetic may cause a decrease in your heart rate and peripheral vasodilation, right? Because you can't sustain yourself with a constant increase in heart rate and your sympathetic nervous system. So someone that's under so much stress all the time, their sympathetic nervous system's constantly kicking in. It's not good for them. It's not good for them because their parasympathetic's having to work overtime. That's why they say stress is not good for you. You've got to have some stress relief, some ways to relieve, some healthy ways to relieve stress so that you're not constantly in a fight or flight mode. Like I said, the baroreceptors result in a temporary inhibition of the sympathetic nervous system. And then your chemoreceptors, and they cause respiratory changes. So your chemoreceptors are located again in the aortic arch and the carotid bodies of the medulla, and they sense when they're triggered, they stimulate the vasomotor center to increase blood pressure, because usually it's because you have too much CO2. So your amazing body will, these chemoreceptors will stimulate the vasomotor center to increase blood pressure. Because remember, we talked about how increased carbon dioxide will make your blood pressure go down. Well, if it senses that, it's like, okay, we've got to bring that blood pressure up. So this is how your cardiovascular system is regulated, and how it works together with the rest of the body to sustain you, to keep you in homeostasis. All right, I like this picture because it's color coded, and if you don't really understand about the blood flow through the heart, this is the time for you to learn. You need to find you a black and white picture of the heart and pull the one off the PowerPoint and color with me, because this is important to know. Because you've got to understand this in order to understand preload, afterload, and some of the harder concepts with the heart lectures. So you've got your superior vena cava and your inferior vena cava. You've got blood coming from the body, from the top half of the body and the bottom half of the body. It all empties into your right atrium and goes through your right ventricle and then out to the lungs. When it gets to the lungs, it's oxygenated. Remember, carbon dioxide and oxygen are exchanged, and then it returns from the lungs oxygenated, so it's red, and it goes to your left atrium and your left ventricle. Then up through your left ventricle, through your aorta, and out to systemic circulation. So that is the blood flow through the heart. It's really important to understand this. Your valves are also part of this process. Your right atrium. Your blood flows through the right atrium, through the tricuspid valve. It closes, and your valves are helps your blood going in the right, helps keep your blood going in the right direction. So that's the whole purpose in your valves. So your tricuspid valve closes, and the right ventricle expels blood through your pulmonic valve. So expels blood through the pulmonic valve. The pulmonary trunk divides into the right and left pulmonary artery, and then it carries the blood through to the lungs. Okay, so then once it comes back from the lungs, it goes, like I said, into this left atrium, and then it goes through your mitral valve. And your mitral valve closes, and blood flows to the left atrium and then back up through the aortic valve, and it closes and it gets to the systemic circulation. So So the valves are very important in understanding murmurs. So when you know the valves, if there's a problem with the valve or there's damage to the valve, then you'll have leakage of blood. And what is that? That is your murmur, right? A regurgitation of blood or leakage of blood, that is your murmurs. So that is why it's important to know your valves and your pulmonic and your aortic or semilunar valves. Just that their significance is, that they prevent blood from regurgitating into the ventricles, because remember what I said, the ventricles are your higher pressure, right? So the valves are they're more intricate in this case. Your systole is your contraction of the myocardium. Your diastole is your relaxation of the myocardium. Your stroke volume is the amount of blood ejected with each heartbeat. So 60 to 150 milliliters per beat. And that's, sometimes you'll see that as SV. And then your cardiac output is the amount of blood pumped by each ventricle in 1 minute. And that's 4 to 8 liters. 4 to 8 liters, which is a lot. And you'll see this written as CO. Then you've got your cardiac output is your stroke volume times your heart rate. Some other factors that affect cardiac output is your preload. That's just the volume of blood in the ventricles. At the end of diastole, the stretching of the myocardial fibers. You want to think Frank Starling law. So that's the stretching of the myocardial fibers. You want to also think about the preload determines the amount of stretch placed on those fibers. And we're going to talk more about that, but I just want you to kind of have an overview of it. And then contractility is just how fast your heart contracts, right? And that can be increased by epinephrine and norepinephrine. Think about the sympathetic nervous system. When it kicks in and your heart rate's going fast, your heart's contracting faster. So increasing contractility can raise your stroke volume by increasing your ventricular emptying. And then your afterload is the peripheral resistance against which the left ventricle must pump. So think about your heart as a pump again. Your left ventricle, remember, it's the high pressure pump. And depending on what's out there in your systemic circulation, the peripheral side, that's how hard that left ventricle has to pump. And then you also want to consider, okay, well, is that left ventricle damaged and it can't pump as well to get the blood out? So there's a couple of different factors there. Is there a problem in the systemic circulation, or is there a problem with the pump mechanism? You've also got an electrical system. We're not going to get too deep into this, but just that it works together with the mechanical for this to happen, right? For your heart to be effective. So your SA node is your atrial kick. That's your beginning electrical stimuli, right? To get the heart to kick. Now, all of this can't happen without the action potential. So you've got to think back to the cellular level and the action potential where depolarization and repolarization occur within the cardiac cell. So the impulse is normally started in the SA node, as it's the pacemaker of the heart, and the impulse travels through the SA node and depolarizes the atria, and then you've got your AV node, which controls your heart rate by connecting your right atrium and your right ventricle through this electrical impulse. So, got just pictures of your SA node and your AV node here for you. And then once it's at your AV node, the electrical impulse travels to the bundle of His and down to the Purkinje fibers. And the Purkinje fibers is the ventricular conduction, right? So your cardiac muscle cells have a compensatory mechanism to help with the also to help with the left and right ventricle to contract. I put here this picture with the arteries in it. Your coronary arteries is a complete blood supply of its own. Are you expected to know all of this? You're not expected to know this for us. If you specialize, then you will go on to know where the infarct is, how it affects the EKG. But just be aware that the heart does have its own coronary circulation. I drew here some yellow lines that look like that could be your cardiovascular disease. So you know that they've done studies and that cardiovascular disease is often beginning in people's teen years. So cardiovascular disease is just the buildup of plaque, right? Soft deposits of fat that harden with age become atherosclerosis. Now, the term atherosclerosis is just the hardening. It just means hardening. It's a Greek word, and hardening of arteries. Now, these erythromas are the fatty deposits that prefer coronary arteries, and you may hear it called CAD, or you may even hear it called CHD, coronary heart disease. But all of this is just the building up of this atherosclerosis, the building up of these fatty deposits in the heart vessels, in the coronary supply. Now, this often you will hear sometimes that this is non-modifiable reasons that this happens. Age, gender, ethnicity, family history, genetic, and then there's also the modifiable ways that this can be controlled through lipid levels, through medication, through modifying and taking care of someone that has hypertension, them taking their medicine, stopping smoking, increasing your activity level. If you're overweight, losing weight, diabetes, that just means sometimes that's not modifiable in that you can't control if you have diabetes, but it is modifiable in that you can be compliant. So that's why it's on the modifiable. And then psychological stress is also modifiable. So again, back to your stress management. So all of these things affect your cardiovascular disease or heart disease. And we are going to get more into that. But this again is just a review. And you know that if you also diet, medications, all of these things can help. So that is all I'm going to talk about today. It's, like I said, a review for you. And if you have any questions, please seek me out. Please find me and ask me. And I will see you soon.